How is it not just like gonna fall out and like move about the place?
Here, what noise do potatoes make?
Hey, how's it going? Welcome to the channel. My name is Cassandra and this is where I talk about my life experiences and lessons learned to try and help other people who might be in similar situations. So if that sounds interesting to you, then go ahead and subscribe if you haven't already. As you may already have seen, I need SARPE. And in this video, I would like to share with you a bunch of questions that I asked my surgeon about SARPE and the surgery, so that you still have to ask your own surgeon. Always seek professional medical advice. Always seek professional medical advice. I am not any kind of doctor or a professional qualified scientist. I am only sharing this information with you because I'm the kind of person, I like to have multiple sources of information, cross-reference, try and educate myself as much as possible. So I'm sharing with you some of the information that I got from my surgeon about the SARPE surgery, but this is obviously very, very specific to me and my circumstances. So please don't take anything in this video as directly factual or applicable to you and your circumstances. Always seek your own professional medical advice. I'm not going to explain what SARPE is in this video. I already did a little bit here, and I'm going to release another video shortly about the difference between SARPE, Lefort, osteotomy, all that good stuff. Not here, we're just talking Q&A. All right. Good. So I'm having the surgery in a couple of weeks, and I went for my pre-surgery consultation a couple of days ago, and yeah, I'm just going to share with you then the questions that I asked and what she said. And again, I always like to do a lot of my own research, so this doesn't include all the information that I know from my research. It's just like the outstanding questions that I had and things that I wanted to find out from her. Okay. Oh, and also I have like pages and pages of other information and notes from all of the other consultations that I went to or that I went for with 3 orthodontists and 3 maxillofacial I always forget maxillofacial surgeons, face surgeons. Okay, so 6 doctors altogether. I consulted with 6 doctors altogether, and I have all the notes from what they said about this whole corrective jaw surgery that I'm going on. So if you also want me to share what everyone was saying about the bigger picture in another video, let me know in the comments down below. But let's get on with it, yeah? Okay, so SARPE. So she said that I will probably need 2 to 3 days in the hospital, but it's actually up to me, which I thought was really nice. So that means that, you know, usually people spend 2 or 3 days in the clinic after SARPE surgery, but she told me that it's up to me depending on how I feel at the time, and if I want to leave earlier I can, and if I want to stay a bit longer then I also can. So that's really nice actually. I wasn't expecting that. Just for a bit of context, I am based in Germany, and this is the clinic where this practice does their inpatient surgeries. It's not a private clinic. I don't have private health insurance or anything like that. I'm just on the public health insurance, which is kind of why I'm surprised that they say, yeah, however long you want or need to say that you can. I guess I'm just so used to this idea, like being from the UK, like people just literally will like pop out a baby and have a horrible childbirth and then not even get to stay overnight for one night, you know, so I'm just kind of used to that. But I thought this was really nice. So 2 to 3 days probably, but I can stay for as long as or as little as I like. She said that it would probably be in a shared room, so me and one other person. The reason why that was interesting for me, like when I like my privacy, I don't want to be bothered, but then also because, you know, I need some light entertainment, and I don't even like, I wasn't sure if I would be able to use earphones or earbuds because, you know, jaw surgery, TMJ, everything like that. I didn't know whether it would be allowed to have something in my ears, or if they would be like somehow swollen or delicate, but she said it's absolutely fine. I can use earphones and earbuds directly after the surgery, so that's great. She also said that I'll probably need about 2 to 3 weeks off work. I asked her how long to keep the device in, the rapid palatal expander, how long that needs to be kept in after we stop turning the key, so after the expansion period and during the retention period, how long that would be. And she said that that's really up to the orthodontist, which makes sense because they obviously work in combination and it depends on what the orthodontist wants to do next. So that's fine. He already said to me somewhere between 6 and 9 months. I was just interested to know what she would say. And she said that we would start turning the key only after 5 days. I asked whether we would already expand the palate a little bit during the surgery because I have seen that sometimes they do that. And she said that if there is the possibility to do that, like anatomically, if my body feels okay with doing it, then they can already expand a little bit during the surgery. But if it doesn't want to, then that's also okay. They just do the procedure itself, make the incisions, and then again, on the 5th day, that's when we start activating the device and actively expanding the palate. Something else I also asked her, and again, as I say, I will do a separate video. I'm specifically digging into osteotomy versus Lefort versus SARPE. Maybe I'll throw in a quick honourable mention for MARP. But yeah, just to briefly touch on this, so during SARPE surgery, they make incisions along the Lefort 1-2 piece fracture lines, so along here and along here. And I was thinking, like, don't judge me, okay? I was thinking, right, so when you have your maxillary advancement or your mandibular osteotomy, whatever, like, so when you're moving jaws forward or backwards, they put in metal plates to hold the jaws in the position. But of course, with SARP, you want to expand gradually the palate with this device, so you can't hold in the pieces. So I was thinking, like, if they're gonna cut my jaw into pieces and then they're not gonna secure it, how is it not just like gonna fall out and like move about the place? But what happens is that with the SARP, they're not completely, totally slicing all the way through the bone. They're using, as I say, these Lefort 1 fracture lines to weaken the bone along these lines, these incision points, and to cut through to an extent, but not cut all the way through, as I say, so that it weakens those places, so that when you activate the expander, it already feels like it wants to give way and stretch a little bit, but the surgery itself doesn't actually fully detach those pieces, and that's how your jaw doesn't fall out. Okay, good. Oh yeah, she also then said that I can eat and brush my teeth as normal and that I don't need to avoid rinsing or swishing around my mouth like I did when I had all of my wisdom teeth removed. I'm a little bit skeptical about that because if you watch the stuff about my tongue tie release, they also said that I wouldn't have to change my diet, but it was like the worst pain I've ever had in my life, and I felt like I was gonna pass out every time I ate. So I'm not going to hold my breath about that. I am going to stock up on soft and liquid foods just in case, but she said that I can eat and brush normally and rinsing is fine, that's good. She did, however, give me the hint that cooked food is better than uncooked food, and I thought like, oh, like because cooked food is softer, and she said no, it's actually because raw food is more likely to still have germs on it, so when you cook it, you kill the germs. That makes sense. If you know me, you know I don't like salad or uncooked foods anyway, and it's not because I'm Scottish and I don't like vegetables. I love vegetables, I just like them cooked, okay? Leave me alone. Do you know, so many of my last few videos have been like on a, not a darker note, but they've been noticeably like a lower mood and stuff like that. And it's really nice to be filming this with like a nicer mood. And I think part of it is because I actually was watching some recordings that I did for my other channel. If you haven't checked that out yet, please do. I was watching some videos that I made for that weeks ago and still haven't edited yet. And just to remind myself like, oh, what were these? And they were really funny. So it cheered me up and now I'm in a better mood, which sounds like really, I don't know, conceited or whatever, but that was the whole reason for me starting that channel, to make myself laugh and to have a fun time. So I haven't been able to record any new videos for that channel in weeks because I've been so busy with this and I literally couldn't talk. Yeah, just even watching like the old ones that I still need to edit. They're funny and they entertain me, so that's why I'm in a better mood. And as I say, go check them out yourself as well if you want to get cheered up a little bit too. I also asked my surgeon whether I can continue with the tongue exercises straight away or if I need to take a break. Again, because I had the tongue tie released, I've got this whole tongue tie thing going on. She said that I can still continue. There's no reason why I can't. It just might be more difficult because I'm like really swollen, but it should be fine. So what I did, I spoke to my speech therapist yesterday when I had my appointment, and we just cancelled the session immediately after the surgery so that there is around about a week where I'll still try and do the exercises on my own, but then I won't be like paying to go back and see her for about another week. The surgeon also said that I will not be banded shut. I've seen that it seems to be quite popular for people who have different kinds of jaw surgery, especially for the people in the Americas. I mean, I guess whenever you look for stuff, it always seems to be people from America. I'm not from America, hello Europe. But yeah, it seems to be quite common that people are banded shut after their jaw surgeries, but after the SARPE this will not be the case for me. And the surgeon has explained to me previously as well that she doesn't tend to do that because she believes that it's much more important to try and use the muscles and relearn how to do things sooner rather than later, to not let your body get weak. And yeah, I had a similar experience on my wrist, so I'm all for that. I'm quite happy with the way that she plans to do it. What's also very important is she said do not take any aspirin. She said for about 2 weeks before and after, do not take aspirin, and on the ingredients list it's listed as ASS, which is interesting because she said that if I take ibuprofen or paracetamol, that should be totally fine. I always thought aspirin was like the American name brand for paracetamol. Apparently it's not, so that's good to know. I never knowingly buy aspirin anyway, but now I know what to look out for on the label. And in terms of pain management, she did say that just ibuprofen should be fine. If I want to take paracetamol, that also will not interfere at all. Oh, sorry, the reason not to take aspirin, you probably already know, it's a blood thinner, and you don't want to do that because with the SARPE, when you're trying to expand this incision that they've made in the middle, what you're essentially doing is to open up a wound every so often to let it heal a bit, open a bit more, heal a bit, open a bit more. So that causes a lot of bleeding. And if you're taking blood thinners, that could be very dangerous, and it stops, the blood from clotting and then healing in that space where you want it to heal. So that's why no aspirin. And she said also that they usually don't give people antibiotics unless something happens where they think they need it. So that is good. I generally, don't really like taking antibiotics. She said that the ADHD medication that I take is fine, so I don't need to stop taking that. I asked her if it might be good to start taking like a vitamin B or folic acid, whatever, complex to help with the healing and the tissue regeneration. And she said with a normal, healthy, balanced diet, it shouldn't be needed, so she wouldn't necessarily recommend it. But if I want to, then it's fine. It's not going to be an issue. As I say, there's going to be a lot of bleeding. Apparently it's very common for people after they have SARPE and during the period of expansion, just to start bleeding from the nose all the time, and also to feel a lot of blood dripping down the back of the throat. She said people who have this bigger journey of the corrective jaw surgery, not just the SARPE in isolation, but also in my case, moving the jaws. She said that the main surgeries at the end are completely fine and great, and people tend to respond to those quite well because that's when you're putting everything into the place where it should be eventually in the end. But with the SARPE, she said that everyone hates that because there's just so much blood, you feel disgusting. And also, I don't know if you can see, I don't have functional issues with my bite, so although I do have malocclusion, underbite, crossbite and all the rest of it, it's functional in the sense that I don't have any problems with eating. Whereas once we expand the top palate, that's going to change and I'll no longer have teeth that connect all the way around, and I will have problems eating. So she was like, yeah, you're going to hate it. It's not going to be nice. But then obviously, bigger picture, it will get better. But yeah, everyone, all of these 6 doctors that I saw for my consultations, they all said it will get worse before it gets better. So on the note then of the blood, she said, please, please, please do not blow your nose, even if it feels like really disgusting and gross, because again, that will dislodge the blood clots and it will prevent the healing that we want. So I'm just gonna have to put up with it and wipe a lot, I guess. She also obviously took me through all of the potential risks and side effects of the procedure, a lot of them pretty standard, but she did say like a lot of the risks are exactly the same as if you were to cut your finger and start bleeding from there. She said, you know, it's similar risks there. The only other thing is that there's like a nerve on the cheek that even like when you touch your lip or whatever, it's the same nerve that kind of runs up. So with like doing these incisions along here, it could cause some like numbing and tingling around the cheek area for a little while, but that is totally normal and nothing to worry about. So that's all the things I asked her. As I say, that doesn't cover all of the information I know about this procedure, just the things that I specifically asked. And again, I will do another video comparing SARPE with other surgeries. If you want to know what else is in this book, let me know in the comments. I hope you found this helpful. Again, this is all very specific to me and my circumstances, so please do your own research, speak to your own doctors, and make sure that you're getting accurate information for your own circumstances. That being said, information is power, get multiple sources. So if you enjoyed this video and or found it useful, please do like, share, comment, subscribe for more like this, and I will see you next time. Bye!